I'm your brother and your friend, Steve Oluwatumininu. Diabetes and hypertension are silently destroying your eyes. How? Now, let me tell you how they destroy your eyes. I'll start this by telling you a small story. A woman once came to the clinic. He presented with blurring vision, complaints of double vision, seeing floaters and spots in a field of vision. Now, on the visual examination, by the time I did the fundoscopy, which is the visualization of the posterior segment of the eye, now I noticed there are spots on the field of retina. We call it cottonwool spots, and there's macular edema, and so on and so forth. I now asked her, "Did you have diabetes?" She said no. I now suggested her, "We have to do your blood sugar. That it's very important." Now we did it, and it was very, very high. That is, she has been suffering from diabetes for a very long time and she didn't know. What am I saying? That is, the consequence of diabetes was noticed in her eyes before she was originally diagnosed of having diabetes, and likewise hypertension. Now, let us start with diabetes. Diabetes, this is increase in sugar level in the blood. That is, increase in the blood level of sugar. That is, when there's excess of sugar in the blood. That is what is referred to as diabetes. And this uncontrolled sugar in the blood can cause a devastating effect in our eyes and in our sight. Now, when there is increase in the level of the sugar in the blood supply to the eyes is also including this sugar. Then this increase in the sugar in the blood results into the leakage of blood with its content into the retina of the eye. The retina is the light sensitive tissue at the back of our eye. Now, the retina is the one generating the vision, and the vision now is being transported via the optic nerve to the brain for interpretation. So when there is a blood leakage as a result of excess of this sugar in the blood, causing the blood vessels to swell up and now leak the blood into the retina, resulting into what we call diabetic retinopathy. Then also, this is what resulted into the cottonwool spot, and the reason why you can begin to see floaters or spots in your field of vision. Also, the blood supply to the lens of the eye, which is part of the refractive media of the eye. The lens is transparent, which allows the refraction of light, that is passing and bending through of light through it, to reach the retina, where the vision will be transformed and transported to the brain. When the excess of this sugar in the blood reaches the lens, then it leads to a kind of a deposit into the lens, which originally is supposed to be transparent, and gradually it becomes cloudy, leading to a blurring vision. And this is what gradually leads to development of cataract. Diabetic cataract is totally different from the one that occur as a result of old age or as a result of trauma. Now, let's talk about hypertension. Likewise, hypertension is an uncontrolled blood vessel. There will be a time that we'll discuss on what is hypertension itself, but at this level, let's just regard it as uncontrolled blood pressure. That is when your blood pressure is high above normal, in most cases above 140/90 and upward. That is when you'll be diagnosed as having hypertension. Now, this increase in this pressure of blood within the blood vessels, will also affect the flow of blood within these blood vessels, now causing a kind of leakage or destruction of these blood vessels and allowing blood to leak into the retina, causing hypertensive retinopathy. That is the increase in the level of the blood flowing through the blood vessels. And we know there are blood supply to the retina, which we said is a light sensitive tissue at the back of the eye. When the pressure within these blood vessels is so much, it destroys all these small blood vessels and allow the pouring of blood into the foundation or into the background of the retina, which is, we regard it as hypertensive retinopathy. And this bleeding into the retina also causes the bleeding into the macula. The macula is part of the retina, causing macular edema, and all these things can seriously affect vision. Also, increase in the blood pressure also causes an increase in the intraocular pressure of the eye. The intraocular pressure is the pressure within the eye, and when the pressure within our eyes is too high, then it causes a disruption to the optic nerve. Now the optic nerve is the one transmitting the vision that is being generated by the retina to the brain for interpretation. And that is why at times we can see a baby playing with snake. Is it that the baby didn't see the snake? No. After all, the baby sees the snake, but it's because the brain capacity at that particular time has not developed to the extent of telling the baby that this snake can be hazardous to your health. It is dangerous. That is, the eye will see, the optic nerve, the eye will see, the retina will generate the vision that you've seen, the optic nerve will transmit this vision to the brain will now interpret and send the negative feedback, send you back the interpretation that is the result of the interpretation that, okay, see, this is snake, you have to run away from it, it can be dangerous. So increase in blood pressure causes the destruction or causes increase in the intraocular pressure, and the increase in the intraocular pressure of the eye causes a destruction to the optic nerve, which we said it transmits impulse from the retina to the brain for interpretation. Now, how can we now solve this problem? We need to control our blood pressure and our blood sugar. Now, the diabetes, we need regular examination of our blood sugar. Then we need to be taking our medication regularly. We need to take care of our dietary modifications, because there are some diets that are expected to be taken by someone diagnosed with diabetes. So the diet, we have to maintain the dietary modification and as well lifestyle modification. This also applies to hypertension. We need to control our blood pressure. We need regular examination of our blood pressure. We must be committed to intake of our medications. Then follow-up visit. Try to always go for your follow-up visit as your follow-up date. Dietary modification is also very, very important, like the low sodium intake, that is low salt intake, and so on and so forth. Regular exercise, not a strenuous one, but a regular active exercise is very, very important for anybody diagnosed with hypertension. And lifestyle modification is also very important, like you have to quit smoking, you have to quit taking alcohol, because all these things honestly can trigger increase in the blood pressure. If you find this my video very important and if you think you benefit from it, kindly subscribe to my channel and also press the notification button beside it so that you can have access to more of my educative videos. Please kindly subscribe. Thank you and God bless you.